You're watching this video because your doctor has recommended an Achilles tendon repair. An incision is made through the skin above the torn ligament. The section above the tear is pulled back down. Threads are then passed through the tendon. Holes are drilled in the heel bone. The threads are then passed through the tendon beneath the tear. They are then anchored into the heel bone using screws. The skin is then closed with sutures or skin staples. The contents of this video are a general depiction of this procedure and the risks involved. It's not necessarily accurate for your personal situation. Information specific to your individual circumstances is listed in the written consent information sent to you by your healthcare team.